One thing I'm very well known for is removing moles, something that seems so simple. And why would this doctor be known for taking out moles when anyone can do it? Well, it's because I care more. And I will tell you something very interesting is when I talk to patients about a facelift incision, I briefly talk about the facelift incision and I just go on with it. I don't even dwell on it because my facelift incisions oftentimes heals like seamlessly. Moles are different. And the reason is, think about this, a mole is sitting right in the middle of the face somewhere where there are no ways I can hide it. I can't hide along behind an ear. I can't hide it somewhere where I can make it disappear. It's sitting on naked skin. Now you take that on someone that's much younger. Let's say they're 25 or 30 years old, because oftentimes a 25 or 30-year-old doesn't need a facelift. But that 25 or 30-year-old has no wrinkles, their skin is flawless, and now I'm making an incision right in the middle of their face. So that level of concern I have for a mole excision oftentimes exceeds the level that I'm concerned about a facelift, because that scar has to look as flawless as possible because I can't hide it. So we have to think about the mole removal first and foremost, thinking about scar management. So I want to talk to you about ways to manage scar when it comes to mole excision. Then we'll talk a little bit more deeply about what the mole removal is all about. So if I'm going to cut the mole out, how can I manage the scar? So first of all, multi-layer closure. In the old days, in my older videos, I had the opposite philosophy, which was a short-term epidermal, an outer skin stitch, and a long-term inner stitch to hold that dermis together. I found the problem is that the dermal stitch can spit over time, and the epidermis, with the reason I wanted to take it out was to avoid track marks. Really, with the right stitch, that doesn't occur. So in 2015, I was lecturing on rhinoplasty in St. Petersburg, Russia. I learned a new technique for rhinoplasty closures using a stitch called 7/0 vicryl, which is a stitch that stays in for a few weeks. And I was, wow, all of a sudden my rhinoplasty results, like the incisions were virtually indetectable very quickly. And because it's dissolvable, I can go in there and put another 10 or 20 stitches in if things were not perfectly aligned and not worry about having to take every little stitch out. So that causes discomfort for the patient. It takes me a lot of time to take it out. Now I don't have to worry about that. But I found something very interesting. If I use a shorter dermal stitch, that's the deep stitch, and a longer lasting dissolvable stitch called 7/0 vicryl for many weeks, not only do I not really see any track mark issues, but the wounds heal so much better, the incisions heal so much better. So I've almost reversed this from the video that I shot maybe 10 years ago. And the nice thing with this stitch, it stays in for a few weeks. If you say, well, I can't go through that, I mean, the recovery is going to be too long. Well, think about this. Your incision is going to be visible for weeks to months. And so my goal is to make that incision heal well. So the 7/0 vicryl is very light, it's white colored, so it's flesh colored, if you will, except for African Americans. But African Americans or Indians, oftentimes they don't even see it because it's as thin as a hair, so it's so small. So that stitch is really nice to stay there for a few weeks because it lets things heal so much better. So longer epidermal stitches, shorter dermal stitches is really, for me, the gold standard today of getting really good results with shorter recovery times. Better healing of the incision. The second thing that I do is I use Botox, so botulinum toxin. It's really amazing. I don't charge extra for that, but injection of Botox into the incision can heal really well. Sometimes I do it the day of the procedure, sometimes I do a week out. I don't think it really matters, but they've done studies where they did a thyroid incision and they compared right versus left. One was saline or salt water, the other side was the Botox at a week out, and 6 months later they looked at the incisions and the side with Botox was undetectable. So Botox works really, really well to help incisions heal well as well. Now, in my old video, I've always said this, and I believe this, that half the battle for moles is the postoperative experience and half the battle is the good surgery. So I've just talked about the good surgery. I want to talk a little bit about afterwards of what things I can do and you can do to make these incisions heal really, really flawlessly over the period of the year. Because, as I alluded to earlier, the little incision will be there for the rest of your life. The goal is to make that incision really hard to see. And the goal is to make that incision hopefully not be a long, long recovery time. Although, as I said earlier, for weeks or months, there could be a little more visibility of that incision until it really fades away. So how do we take care of it afterwards? So number one, I told you about sometimes I Botox it a week. Second of all, long-lasting stitches. To me, that's part of the aftercare as well. The other thing is for that first week to keep it super moist with Vaseline, Vaseline, Aquaphor, it doesn't really matter, just something really moist. After 7 days, you're going to use a silicone gel or silicone sheet. If it's on like the forehead areas, I would be using a sheet. If you're using on the lower face, using a gel, I've actually developed my own sheets and gels with the purest grade silicone that's non-adulterated. I don't believe the ones like Mederma, they just use brand names, that have vitamin E oils and other fillers in my onion extract really do anything. I don't think they really work well. In fact, when I was developing my own, I actually, it was much cheaper for me to develop one with all those fillers in it because silicone is super expensive, especially the sheets. So by using silicone afterwards for at least 12 hours per day after the first week, the incision can heal much better. Now, if it's in the lower face, silicone sheets really have too much mobility, very hard to stay on. But the sheets heal a little bit better than the gels. So if you're having a mole removal here, I would use gels. If you're up here, you can use sheets at night if you don't want someone to see the sheets, and gel during the day. But if you don't care, I would just use sheets 24/7 on that. Really, for the first 8 to 12 weeks, and if it's healing so well, you can stop. But some people like to do it for even the first 6 months. After that, it's not so critical. But that first few weeks to months, silicone sheets and gels can make a big impact as well. And sometimes a little additional Botox can help as well. I don't charge for that if I need to do that as well. And all my postoperative care is included in this. So the other things that I do is dermabrasion. Now, dermabrasion is very different from microdermabrasion. The most popular thing is talking about microdermabrasion, which really is just like an exfoliant. I'm actually sanding it down to get the edges clean, because no matter what that incision looks like, sometimes a little bit of blurring with the dermabrasion can help. And that just takes me literally about 30 seconds to do it. So that is another thing that can be very helpful as well. And that I don't do typically earlier than 3 months, sometimes 6 months, and really see if you even need that. The recovery is pretty fast. If I do dermabrasion, I would tell you to stop the silicone for that week and then just use like an Oxygenetics, which is a makeup product that has silicone in it that covers it up. So it makes that little skin burn, which is only a few millimeters long, it depends on, of course, the mole I removed. But cover that up with Oxygenetics makeup, which really heals well. I have that also in my office. We can color match you for that. And then sometimes the scar is a little bit thicker, and then I use something called 5-fluorouracil or 5-FU with a dilute steroid. The reason I use 5-FU is that if you use straight steroids, there's a risk of dermal atrophy and causing issues with the skin, whereas 5-FU works really, really well to do this. And also for areas that are very sensitive around the mouth, if I'm cutting out the mole, this is an area that I do a dental block, which doesn't hurt. So this is a sensitive area. This is an area that can be uncomfortable if I'm taking a mole out, but by doing this painless dental block, it makes the whole experience incredibly easy for you as well. For people that are very nervous, I can give them nitrous gas as well during the mole excision, and that's fine as well if you want that. So the excision process, I didn't even talk about it, but to me, it's really the basic techniques that make a difference that I just talked to you about, and the aftercare. But I'll just briefly tell you this: if a mole is flat and just has a little color, I usually just burn it away. Now, the risk of just burning it away is that it can come back. But if I'm gonna have to do a cut, the cost goes up, the recovery goes up, and all those things I just told you, the stakes go higher. But if there's any elevation to the mole, or the way I look at it is like an iceberg. What's above the skin is below the skin. And if I just burn it off, it's gonna come back, and it's gonna come almost fully back. So if there's any elevation to the mole, I will cut it out. And I cut it out along what's called a relaxed skin tension line, which means that our collagen bundles run in certain ways in our face, like this here, this here, this here, this here. And if I don't respect that collagen bundle, the scar will heal much worse. So relaxed skin tension line, undermining the skin so there's no tension on the closure, multi-layer closure I already alluded to. So those are the key things with mole removals. I hope this little video has given you some understanding about how I do it, how I take care of it afterwards, and why all those concepts are very important.